Hey guys, welcome back. And today we'll be talking about the saphenous vein, a part of the venous drainage of the lower limb. This great saphenous vein, vein, its course, its tributaries, its clinical aspect, all this I'll be telling today. This saphenous vein is the largest, longest, and present superficially, and it is a preaxial vein. It's a preaxial vein. Now let us talk about the course of this great saphenous vein. Before that, we should know how this great saphenous vein is formed. Formation. If you consider this as a dorsal venous arch, this is the medial end, this is the lateral end. The medial end of the dorsal venous arch together with the medial marginal vein of the big toe together forms the great saphenous vein. So medial end of the dorsal venous arch and the medial marginal vein of the big toe together form the great saphenous vein. This great saphenous vein run upward in front of the medial malleoli. In front of the medial malleoli, run obliquely in the lower medial part of the leg, and then ascend behind the medial border of the tibia, later reaches the knee joint. In At the point of the knee joint, it is present posteromedial, one hand breadth posteromedial to this patella, and later it runs along the medial side of the thigh and finally reaches the saphenous opening, pierces the cribriform fascia, and finally drain into the femoral vein. This is all about the course of the great saphenous vein. Now, coming to the tributaries. So, whenever you write something about a vein, writing about its tributary plays an important role. Yeah. Now, what are its tributaries? At the commencement means formation, we find the medial marginal vein of the big toe in the leg, a communicating branch between the small saphenous vein and the deep vein and the posterior arch vein. This posterior arch vein is actually formed by the medial three ankle perforators. This posterior arch vein, this is very large, that collects the blood from the posteromedial aspect of the calf region. Posteromedial aspect of the calf region, just below the knee joint. Just below the knee joint, it will be having the tributary, namely the anterior leg vein. This will extend, actually it diagonally crosses the shin. Shin means the tibia. There's a tibia, it crosses this tibia diagonally and joins the great saphenous vein and a few veins from the calf also. Now in the thigh region, anterolateral vein, posteromedial vein. Posteromedial vein. Sometimes this posteromedial vein is also called the accessory great saphenous vein. Okay, just before piercing the cribriform fascia, it has some tributaries, namely superficial epigastric, superficial circumflexiliac, and the superficial external pudendal. Just before terminating into the femoral vein, it will be having the deep external pudendal. This deep external pudendal is the last tributary of the great saphenous vein. Great saphenous vein. Now, actually, there are 10 to 20 valves in the great saphenous vein. 10 to 20 valves, but what number of perforators are? 5 in number. These valves are present in two locations, namely one just before piercing this cribriform fascia, and one at the junction of the femoral vein and the saphenous vein, namely the saphofemoral valve. Saphofemoral valve. So this plays a very important. The saphofemoral wall is very important. So in 80% of people, what happen is there is a valve in the external iliac vein. External iliac vein. This is a valve present in the external iliac vein. This will be protecting the saphofemoral vein from the high pressure of the venous blood. So in 20% people, what happens is this valve in the external iliac vein is absent, and therefore the saphofemoral valve is not protected from the high pressure of this venous blood, and therefore that leads to the varicose veins. That lead to the varicose veins. Now, this is all about the Great Saphaneous vein. Firstly, you have to write about its intro, formation, course, tributaries, and valves, importance of the saphofemoral valve, and next coming to it is the clinical aspect. The clinical aspect, the first one, include the venous section of the Great Saphaneous vein. Venous section of Great Saphaneous vein. So Great Saphaneous vein is present in the superficial fascia, that too very conveniently located in front of the medial malleoli. In front of the medial malleoli. So in this region, it can be cut down. That is called the venous section. This is a preferred site that is in front of the medial malleoli. It is a preferred site for the venous section. So whenever their superficial veins have been collapsed in the body or invisible, in order to insert the cannula for prolonged administration of the intravenous fluid. So during prolonged administration of intravenous fluid, when you don't find the superficial veins or superficial veins have been collapsed somewhere in the body, you use this Great Saphaneous vein for administration of the intravenous fluid. So during this venous section, care must be taken that in front of this Great Saphaneous vein, in front of this medial malleoli, the saphenous nerve is also present. The saphenous nerve is present. So while performing this venous section, the care must be taken that this is avoided from injury. This is avoided from injury and it has to be protected. This is all about the venous section of the Great Saphaneous vein. Now coming to the Great Saphaneous vein graft of the Great Saphaneous vein. So in the coronary bypass surgery, so why do this happen is these coronary arteries, when they undergo occlusion, these occlusions has to be removed. So for that we will do coronary bypass surgery in order to relieve the ischemia of the heart. So what actually happens here is a segment of the Great Saphaneous vein is removed and is used as a aortocoronary grafting. As the name suggests, aortocoronary. So here it is being connected between the aorta and the obstructed proximal part of the obstructed coronary artery. So the problem here is the Great Saphaneous vein, we know they have many valves, 10 to 20 approximately. Therefore, in order to avoid the obstruction of this flow, this vein has to be reversed. It has to be reversed so that valves do not restrict the blood flow. And this, I told no here aorta here is obstructed vessel. This aorta will be having very, high velocity of blood flow. As this blood flow goes into the obstructed area, here the occlusion can be cleared and the heart will get relieved from the ischemic condition. This is all about the Great Saphaneous vein, its clinical aspects. Okay guys, thank